What are the risks of not taking action if you have scoliosis? Hey, Dr. Chris Gubbels, and today I want to talk to you about the risk of not properly treating scoliosis. First, let me start off with infants. When we look at infants with idiopathic scoliosis, idiopathic means we don't have a known cause. 80% of all scoliosis is idiopathic scoliosis. But in infants, about 50% of these cases actually self-resolve. There are some things we will look at to give us a predictor if we think they're going to resolve. One is a rib vertebral angle, and it's how the ribs actually align with the vertebrae. And if we have a rib vertebral angle of greater than 20 degrees, meaning the angle on one side is more than 20 degrees greater than the other side, that's a high predictor of a case that's not going to progress on its own. The other thing we'll look at is when we look at the spine and we look at the rib cage and we see the vertebrae, we should not have a vertebral head that's laying over one of the vertebrae. If we do, that tells us a lot of rotation, and those cases are more aggressive. One thing about infants when we're treating scoliosis, a lot of places, a lot of hospitals are still doing serial casting, and whenever they're doing serial casting, they're doing general anesthesia. But there's a lot of research that shows that doing repeated general anesthesia on an infant can have potential mental or neurological or psychological developmental issues. So there are better options like custom bracing using what's known as CAD/CAM technology, which means computer-aided design and computer-aided manufacturing, where the infant won't actually have to go under general anesthesia. When we're looking at adolescents and juveniles, these curves tend to progress the most during growth spurts. And this is generally, like the curves take off the most during the first year of puberty. In girls, this is typically between the ages of 10 and 12 years old, and boys is somewhere most of the time between the age of 13 to 14. We look at the severity of the curve, meaning how big the curve is, and also how much growth is left as predictors of likelihood of progression. If we have a curve that's over 20 to 30 degrees and they're what's called risks are zero, meaning they're not really near skeletal maturity and they're maybe just hitting that first year of puberty where they're going to really take off, it's called the peak growth velocity, that's a high risk of progression. And if we don't do proper treatment, it has a pretty high likelihood of getting worse. But let's say we have a 20-degree curve and someone is risk 4, which means they're already later on in their growth and their growth is really slowing down and they're getting closer to skeletal maturity. A curve like that is not as likely to progress and definitely not progress as fast, so it's not as concerning. So we look at how big the curve is and how much growth is left. If we have real small curves, let's say 10, 15 degrees, sometimes we can do what's called observation. We don't watch and wait. Observation is an act form of treatment where every few months, probably every 3 months, the child is being reassessed and a new exam is done, and at least a new x-ray every 6 months to develop or watch and monitor that scoliosis to see if it starts to progress and if things like scoliosis-specific exercising or bracing are needed. Generally around 20 degrees, 25 degrees, that's when we look at doing bracing. Anywhere from 10 to 20, we may do scoliosis-specific exercises on its own. But when it gets beyond 20 degrees, when someone is still has a lot of growth left, that's when bracing becomes a good option. When we look at adults, it's generally believed that curves under 30 degrees have a much less likely chance of progressing in adulthood. But there's other factors. For example, where that scoliosis is located. A scoliosis in a thoracic spine is not as likely to progress when someone's done growing compared to a scoliosis located in the thoracolumbar junction or the lumbar spine. It's because up here you have the rib cage to help strengthen and stabilize them, and when we get curves that are lower in the body, we don't have the rib cage to stabilize them, so they're a higher risk of progression. Other things like if someone has an anatomical short leg or a true sacral obliquity, so their spine is not sitting on a level surface, that can drive or enhance and increase the chance of a curve progressing. In adults, curves over 30 degrees are considered to have moderate risk of progression, and a curve over 50 degrees is considered to have basically 100% risk of progressing. Whether it's an adolescent or an adult, The earlier we detect these and the earlier we start doing the most appropriate treatments, the better the long-term outcomes. And the treatments that are actually shown to be effective, things like scoliosis-specific exercising and custom bracing. When we do bracing, it's different in adults and adolescents. In adolescents, we are actually trying to impact how the spine grows so it actually grows with less of a deformity. In an adult, we're trying to reduce pain, stop, or dramatically slow the rate of progression, because in adults, it's a degenerative problem where the spine is actually breaking down, compared to when someone's in adolescence, the spine is actually growing asymmetrical. So we have different goals. But we also know in adults, if we catch small curves earlier, we have a much better chance to keep them from progressing to a larger curve or a larger degenerative curve. And the bigger a curve gets, generally the greater the pain or disability gets too. So if we can even treat some curves when they're small in adults, we have a much better likelihood of having a great long-term outcome. Additionally, a lot of times we get young adults that come in, their spines are still pretty flexible. The stiffer a spine gets, the harder it is to try and impact. But sometimes in adults that are flexible, we can even reduce the size of those curves, especially if they have a big coronal imbalance. We can get the spine back to a balanced position, which does a lot to reduce pain and disability. How do we detect scoliosis in children? One, parents just need to observe their children. See if you notice things like uneven shoulders, a head shifted to one side. When they bend over, if you see a rib that's humping on one side, if you see a shoulder blade that sticks out, if their pant legs don't appear to be the same length, meaning one side is longer and one side appears shorter, if you see asymmetries in the waist, those are all potential signs of scoliosis. In adults, if you have pain, go in and see someone, get an x-ray of your spine, see what's going on, because you could be someone that had scoliosis when you were younger and it wasn't a bigger issue, and now it's progressing and degenerating and becoming a bigger problem. Or it's possible you never had scoliosis or weren't aware of a scoliosis and you have one developing. So we have a lot of adults that come in with back pain that their pain is being caused by scoliosis and they had no idea they had scoliosis, or yeah, they had a small curve when they were younger but completely forgot about it, and now that small curve has become a big curve. So it's a good idea to get screened when you're younger, and if you have any kind of problem, pain as an adult, go in and get checked. In conclusion, if you had an adolescent, girls should be screened for scoliosis at the ages of 10 and 12. Boys should be screened between the ages of 13 and 14. And if you're an adult and you had scoliosis when you were younger, it's a good idea to get a checkup and see if that curve could be progressing. If you have back pain, it's a good idea to go in and see someone that will actually take an image, an x-ray of your spine to see what's going on. Because if you have a spine deformity developing like scoliosis, you want to get the most appropriate treatment early on. And then if you find out you have scoliosis, make sure you're seeking out an actual expert, someone that's truly trained in properly treating and managing scoliosis.
So if you're finding this information useful, like, follow, or subscribe, and share with others you think would benefit from this information. And if you have scoliosis or you have a child that has scoliosis, don't hesitate to reach out. Just give our office a call and ask for a free consultation to see if there's something we can do to help you.